The content of this video is not medical advice or a substitute for physical therapy. Please consult your physician or physical therapist before starting any exercise program.
I want to share with you a couple of ways to address a tight, grippy piriformis muscle. Now, piriformis is a deep lateral rotator of the hip and is found over here kind of on the side of your pelvis. It can get called on by the nervous system to substitute for a weak or faulty glute muscle or buttocks muscle. And because it's so small and poorly positioned to do the job of the glutes, it can become very sore and irritable, sometimes even giving you sciatic-like symptoms because it actually sits right on top of your sciatic nerve. So in order to address this, what we're going to do is go down to the floor and you're going to lie on your back. We're going to cross the leg on the side that we're going to address. And when you cross this leg, you're going to let this knee rotate out to the side. Now, when you're rotating the leg out to the side like this, make sure that that rotation is coming from your hip and not from your knee. So this should never stress your knee here. Now, if you're not feeling a stretch in this position, go ahead and bring both legs towards your chest until you start to feel a mild to low moderate stretch in this outer hip area. Once you feel that, you're going to hold it for a moment and then you're going to back out. And what we're going to do in this particular technique, it's called an on-off stretch. We're going to go into and out of this stretch maybe 8 to 10 times. So for the sake of the video, I'm only going to do it 4 or 5 times. But what I want you to get the feel of is that we're not holding a stretch. We're not trying to fight the muscle and make it give up. We're simply asking it to give us a little bit more length. And by way of doing this, we're restoring healthy blood flow and helping waste removal take place and all the good things that keep muscles healthy instead of making this muscle fight and actually get more and more irritable and hurt worse. So once again, you're going to do this 8 or 10 times just to get a little bit more length, create some warmth and some blood flow in that muscle. Now, once you finish that particular movement pattern, you can take this knee and bring it towards your opposite shoulder. And so this is a little bit different direction for the same muscle, working on some different fiber lengths, but same idea here. We're going into and out of the stretch, feeling a little stretch across this outer hip here, and then releasing it to the start position, making sure we're not causing more irritation here. We're just trying to get a little bit more length out of the fibers and restore blood flow. So that's it for your tip today to get piriformis moving a little bit better. I hope this was helpful to you. As always, if you like it, please click all the buttons and subscribe to my channel. Also, leave some comments and let me know what other types of tips would be helpful to you. And until I see you next time, keep moving and be well.